today by acknowledging the Awabakal people, the traditional custodians of the land on which we are recording today, and pay our respects to their elders past and present. I extend that respect to Aboriginal and Torres Strait Islander peoples listening today. Tonight on the 7:30 report, we are joined by 4 law students from the University of Newcastle who are currently researching prisoners' access to healthcare in Australia. Let's hear what they have to say.
Medicare is currently unavailable to all people incarcerated in New South Wales. Consequently, research indicates that prisoners are more likely to experience chronic and acute illnesses in comparison to the general population. We recommend that the Minister for Health should grant prisoners an exemption under Section 19, subsection 2 of the Health Insurance Act 1973 on the basis of disadvantage. This would enable prisoners to access Medicare and subsequently the Pharmaceutical Benefit Scheme and My Health Record. This would assist in overcoming the barriers that prisoners experience in accessing sufficient levels of healthcare, administering services that are unavailable, improving information sharing, and reducing deaths in custody. This would ultimately ensure that Australia upholds its treaty obligations and decreases recidivism as well as the associated costs.
Medicare is Australia's publicly funded universal healthcare insurance scheme. It is regulated under the Health Insurance Act 1973, now referred to as the Act. Section 19, subsection 2 was amended in 1976 as the associated economic expenses of the Medicare became evident. This section provides that when health services are administered by state or territory governments, Medicare is not available unless the Minister for Health grants an exemption. As such, services are assumed to have alternative funding. Consequently, Medicare, PBS, and My Health Record are not available within the prison system, as the healthcare of people incarcerated is the responsibility of state and territory governments. For example, Justice Health and the Forensic Mental Health Network is a statutory health corporation within the New South Wales public health system, which is responsible for providing health services to those who are incarcerated.
Prisoners experience numerous barriers in accessing sufficient levels of healthcare due to the absence of Medicare, the PBS, and My Health Record. These barriers include, but are not limited to, extensive wait times to see medical professionals, significant delays in receiving medication, and poor communication. For example, Browley and the Queen demonstrates the difficulties that prisoners experience in accessing medication and the extensive wait times. Browley was assessed by a medical practitioner 11 days after being admitted, receiving only 1 of his 3 prescribed medications in this time. Further, Browley made numerous health-related complaints in October 2021, but was only put on a list to see a doctor in March 2022. Many prisoners do not have access to services that are available in the community, as they are too expensive to be administered without Medicare rebates. For example, most prisoners do not have access to ongoing psychological services. This often exacerbates mental health problems, which in turn increases the risk of recidivism and strain on public health services post-release. In addition, as My Health Record is unavailable, Justice Health uses multiple information management systems that are not sufficiently linked to transfer medical records and appointment schedules when prisoners are moved. This often results in extensive delays, leaving prisoners untreated and receiving ineffective healthcare. These impacts ultimately lead to poorer health outcomes and increased deaths in custody. For example, in 2021, a coronial inquest found that Nathan Reynolds died in custody from bronchial asthma. The inquest noted that the healthcare he received in custody was deeply inadequate for a person suffering severe asthma. The response of staff was also unreasonably delayed and uncoordinated during the asthma attack.
Further to these impacts, research indicates that Australia is in breach of specific treaty obligations due to the inadequate healthcare provided in the prison system. Granting an exemption would greatly assist Australia to uphold such obligations. For example, research has indicated that Australia is in breach of Rule 24, subsection 1 of the United Nations Standard Minimum Rules for the Treatment of Prisoners, as access to primary healthcare is not at a level comparable to the community, where a person may present at an emergency department. This is predominantly due to the barriers previously discussed that exist as a result of the absence of Medicare, as well as resource limitations and environmental constraints. Further, the United Nations Human Rights Committee held in Landsova and Russian Federation that under Article 6, subsection 1 of the International Covenant on Civil and Political Rights, states are obliged to provide healthcare to prisoners where it is deemed required. By applying this, Australia is evidently in breach by failing to provide certain health services and placing individuals in solitary confinement where they display signs of mental illness.
As noted, Section 19, subsection 2 of the Act provides that the Minister for Health can grant exemptions. The principle behind this was outlined in the second reading speech for the Health Insurance Amendment Bill 1976, where it was stated that the Minister should have this power to ensure that individuals are not disadvantaged in any circumstances. From the earlier discussion, it is evident that prisoners face significant disadvantage when accessing healthcare. Thus, in accordance with the second reading speech, an exemption should be granted under Section 19, subsection 2 to allow prisoners to access Medicare. It should also be noted that the Minister for Health has previously granted several exemptions. For example, the Inala Indigenous Health Service in Queensland, which aims to provide culturally appropriate health services for Indigenous people, was granted an exemption in 2006.
In addition to overcoming disadvantage, granting an exemption would assist in improving the physical and mental health of prisoners by enabling access to fundamental services, as highlighted in the coronial inquest into the death of Kevin Bugmy. This would likely result in a reduction in reoffending upon release, and consequently the associated costs, as research has linked poorer health outcomes in custody with the return to criminal behaviour upon release. If you consider that the cost of incarceration on the government is equivalent to $361 per person per day, and the government is spending approximately $5 per person per day on Medicare, then you can see that the financial burden of granting an exemption is insignificant when you consider the likely reduction in reoffending.
Therefore, granting an exemption under Section 19, subsection 2 on the basis of disadvantage would greatly assist in decreasing the barriers that inhibit prisoners' access to healthcare, improving information sharing, reducing deaths in custody, and ensuring that Australia is not in breach of its treaty obligations. Further, this would likely result in substantially improved health outcomes for prisoners, which would lead to a reduction in reoffending and the associated costs. Thus, we strongly recommend that the Minister for Health grants an exemption to enable prisoners to access Medicare under Section 19, subsection 2 of the Act.
Thank you for those insights. We'll see you after the break.